cultural competency is dealing with people in a compassionate way, no matter what culture that is.
Being non-judgmental and just interacting with the patient and understanding what their culture and beliefs are without involving yours and your biases.
Having an understanding of where that client is coming from, being able to ask if I don't understand something about their culture.
When we come into the hospital, you can't just put everyone into this box. We have to take into consideration their culture, which could be their beliefs, their norms, any practices. Like I know specifically with some cultures, looking someone in the eye can be a very negative thing versus in our very European culture, we want that face-to-face. So it's just having a global understanding of what somebody's bringing to the table when they come to the hospital.
In the past, sometimes going to an institution or going into a healthcare environment meant giving up a whole lot. Giving up a lot of power, giving up autonomy, giving up any ability to really have a say in how things go. And so here I think it's about giving that power back.
With cultural competency in place, the patient will have less fears, less hesitation, less walls and less barriers to the care that they are here to receive. They stand less chance of walking out without receiving any care if we are culturally competent towards them when they come in.
They have some traditional medicines around the room, so I respect it. I don't throw it away, and I just leave it until the patient is discharged. So they really appreciate when you respect the traditions.
You can't know everything about every culture. It's important to ask people individually. I include it in my assessment. People aren't going to be offended by you saying what's important to you or what do you need from me in order to get the best care. And then I find people are pretty apt to share with you all those little things that are important to them. So that's where I think the foods will come up, or people will bring up their own medicines.
Originally, our First Nations training was over 2 days, and we spent the 2 days with a First Nations elder. In my case, it was Elder Van Bibber. Generally speaking, a lot of our clients come in alone, afraid. Ruby would pretty much explain what would happen from the time a person left the community to the time we put them back into the community. To be able to understand how that circle worked benefits us as employees here, so that when a client does have an issue, we can address it immediately and make them feel a little bit more comfortable, as well as get them home as soon as we can.
I believe that asking and increasing your knowledge is very important in the care of the patient, or just understanding other cultures in general. Working in a healthcare setting, the patient is number one. That's who we're here for. So getting a good understanding of their views, but as well, First Nations Health is very knowledgeable in the different cultures. I'm not an expert by any means, so I take the opportunity to learn and ask questions about aspects of culture.